Okay, so imagine this. You're swamped at work, crazy day, and bam, hit by dizziness, heart's pounding, sweating.
Oh, man, I know that feeling.
Right. First thought, a panic attack. But what if? It's something else entirely. Today's deep dive, we're getting into that. Hypoglycemia, low blood sugar, in plain English.
And while most folks link that straight to diabetes, this article, it's really saying anyone can get it. In fact, it's often missed in people without diabetes, which is why we're digging into this.
That hit me too, because even if you're not diabetic, this stuff matters. The dangers of mismanaged hypoglycemia, they're the same no matter what's causing it. But get this, CDC reported 250,000 ER visits just for hypoglycemia in diabetics back in 2018 alone.
And that's likely just the tip of the iceberg, right?
Yeah.
When you think about folks without diabetes, where the tracking isn't as good, that number's probably way higher. Really shows how important understanding this is.
250,000.
Mm.
Underreported. Okay, now that's eye-opening. And it gets even more interesting. The article, it lays out this Whipple's triad thing for diagnosing hypoglycemia.
It's actually quite elegant when you break it down. Think of it like a 3-part test. 1, got to have those classic low blood sugar symptoms, dizzy, shaky, confused.
Right.
2, blood test to confirm your glucose is actually low. And 3, those symptoms, they vanish once your glucose is back to normal.
So like medical detective work, but instead of fingerprints, it's blood sugar.
But here's where it gets tricky. Yeah. The article also mentioned that these symptoms can be different for different people. Exactly. Like someone with diabetes might handle lower blood sugar than someone who doesn't have it. That's why just going off a generic symptom list can be a trap. Gotta listen to your own body's cues.
Okay, so no one-size-fits-all approach here.
Oh.
Gotcha. Speaking of symptoms, gotta admit, when I saw that table in the article, all those possible symptoms, some, especially the neuroglycopenic ones, kind of freaky.
It is concerning, yeah. When your brain isn't getting enough fuel, it's like running a car without gas. Stuff starts shutting down. That's how you end up with those severe effects, trouble speaking, confusion, even seizures if it gets bad enough.
Seriously, mimicking a stroke. Okay, that's intense. Really drives home how crucial it is to catch and treat hypoglycemia fast. But before we get into treatment, back to those costs for a sec. The article said average ER visit for this back in '08, almost $2,000. And that's adjusted for inflation.
And let's be real, that number has probably skyrocketed since then, knowing healthcare.
Exactly. Not cheap.
Yeah.
But what hit me harder were the hidden costs the article talked about. Like missing work because you're out of commission with a hypoglycemic episode. That lost productivity adds up fast.
It's bigger than just the hospital bill, right? It's the ripple effect, your job, your income even. The study linked severe hypoglycemia to higher risk of early death, which is wild to think about.
Hold on, seriously. Missing a reel or two can snowball into that. Okay, this is way more serious than I initially thought.
It is, and it just shows why knowing how to manage hypoglycemia is so important, protecting your health now and down the line.
All right, so not messing around with this, clearly. But what can we do? That's where the whole D10 versus D50 debate comes in, right?
Yeah.
I'll be honest, I always figured D50 was the go-to, like the big guns you break out in emergencies.
Yeah, kind of like that, but it's almost like using a fire hose to water your houseplants, Effective, sure, but there's going to be some collateral damage. This article, it's making a case for D10. Safer, more controlled.
Okay, so ELI 5 here, why is D10 gentler? And what's this about rebound with D50?
Okay, imagine trying to raise a drawbridge, right? D50 is yanking it up with a crane, gets the job done fast, but risks snapping those chains. D10's like slowly winding it up, much smoother. That big glucose spike from D50, your body can actually overcompensate. Your blood sugar plummets again soon after.
Oh, wow. So it's like a boomerang effect.
Exactly. And if that IV isn't perfectly placed, D50, it can damage the tissue around it because it's so concentrated.
Yikes. Okay, that image definitely makes it clear. So D10 avoids those blood sugar roller coasters, and it's safer for your veins. But the article also said D10 might be better long-term, too. What's that about?
Right. Those wild swings from high glucose to low over time, that can mess with your blood vessels, even your organs. D10's less likely to do that. It's the difference between slamming the brakes versus a gradual stop. You know what I mean?
Yeah, your car and your body definitely prefer the smoother ride. I'm starting to think D10 needs better marketing. It's like the unsung hero over here. But those true emergencies where you need a fix fast, the article talked about making D10 from D50 with a syringe. Sounds a little MacGyver-ish.
A little bit, yeah. Shows you how quick medical folks have to think on their feet. But also having options and knowing the ins and outs of each. That's key.
For sure. Speaking of needing a medical dictionary, that sulfonylurea overdose section. Ooh, Got technical fast.
Did pick up that octreotide as the MVP in that scenario, though. Can we unpack that a bit?
Absolutely. So first got to understand, sulfonylureas, those are meds that tell your pancreas pump out more insulin.
Mm-hmm.
Overdose on those, your body's like stuck on overdrive, insulin nonstop. And if you weren't even low on blood sugar before.
Yeah, that's not good, like hitting the gas when you're already aiming for 0 miles per hour. So where does octreotide fit in?
Octreotide slams on the brakes, it blocks that insulin release, basically counteracting the overdose.
So the antidote to the overactive pancreas. Man, knowing how meds interact, that's huge, especially in a crisis. Totally. And that actually leads perfectly into another thing. The article hammered home those discharge decisions. It's not just glucose is up, see you later. Got to figure out why it crashed in the first place.
Treat the cause, not the symptom.
Right.
Like we were saying before, the detective work comes back around.
Exactly. Someone who skipped lunch by accident, that's different from a medication mix-up or some underlying condition. And this is where those long-acting insulins can get tricky.
Long-acting insulins? Why are those especially tricky when we're talking hypoglycemia?
It's like this. Think of them as providing this steady, baseline insulin all day long. Good for overall control, but say your glucose drops suddenly.
Right.
Since they're long-acting, you can't just yank them back or adjust on the fly. Getting that blood sugar back up to a safe level, it's tougher.
So, turning a cruise ship on a dime takes time. Got to be careful. And that's where knowing your meds, talking to your doc, that's non-negotiable.
Bingo. You're your own health advocate, gotta ask questions, understand those long-term risks. Speaking of which, one part of this article gave me chills. Hypoglycemia unawareness.
Oh, yeah. That. Like something out of a medical thriller.
For those of us who skipped med school, what is that exactly?
So it's this thing, can happen to folks with diabetes, especially if they've been living with it for a while. Their bodies, they kind of stop sending those early warning signs of low blood sugar.
Wait, so no shaky hands, no feeling faint, none of that. Those are usually the cues to grab a juice, right? Exactly. But with this, those alarms, they might not go off at all. Or they're super faint, and that's where it gets dangerous, right? They could slip into severe hypoglycemia seizures even without realizing it's happening.
Man, that's scary.
Yeah.
Like their internal warning system just goes offline. Really highlights how important it is to be on top of things, proactive, if you're diabetic.
Absolutely. Checking your blood sugar regularly, understanding how stuff like exercise, alcohol, all that impacts your levels, and those honest conversations with your doctor, can't stress that enough.
All right, so we've covered it a ton in this deep dive, and it's clear. Hypoglycemia, bigger deal than a lot of people think. Symptoms, subtle to severe how it's diagnosed. Treatment options, even those long-term risks. Quite a journey.
Knowledge is power, as they say.
100%. And hey, everyone listening, this is all to help you make good decisions about your health. Not meant to diagnose or treat anything. Concerns. Talk to your doctor. They're the experts on you.
Couldn't agree more. Your health matters, and being an active part of it, that's key.
And on that note, we'll wrap up our deep dive into hypoglycemia. Until next time, stay curious, stay informed, and stay healthy.